or your water or whatever. And we'll be ready to start in just a few minutes. We're going to give it just one more minute. There's still quite a few people logging on. So thank you all for being here and for your patience as we wait for it's a large number of people joining us today. If you are so inclined and you'd like to put where you're coming from in the chat, that helps us keep a record of who we've had an opportunity to chat with. Otherwise, this meeting is being recorded and will be posted to the Early Learning Childcare section of the DCYF website. But we are getting started in just about another minute. I've been waiting for the numbers to stay still for just a second, and it hasn't happened yet. So we'll just give it one more minute, all right? Thank you for your patience. All right, well, with that said, I've seen it hold still now for just a second. The chat box is not, which is great. That means y'all are taking advantage of putting where you're coming from in there, so I appreciate that. But we will get started because we do want to make sure that we have time to hear all of our DOH presentation and then hopefully have some time for some questions at the end. Again, like I said, this recording or this presentation is being recorded and will be posted. So if you missed something, as we have a tendency to try and cram as much as we possibly can into our time, It will be recorded and you can go back and check it out later if you are so inclined. So good morning. My name is Jennifer Helseth. I guess it's afternoon. Good afternoon. I am a health systems analyst with the Department of Children, Youth, and Families, and I have the distinct pleasure of introducing our two subject matter experts from the Department of Health today. We're going to have Amanda, and you know, I realized I should have asked you, Amanda, how to pronounce your last name because I've only ever called you Amanda.
That's okay.
Amanda
My last name is
Geffro. Geffro, okay, I was close. All right, so Amanda Geffro and Kim Sanchez here from the Department of Health, who are going to talk to us about the updated school and child care guidance. So with that, we will have the opportunity for some questions, we think, at the end. So if you have a question that comes up through as we're going, since we are all muted and it comes up at the moment, please feel free to type it into the chat. And we will do our best to try and address them. And we will provide a written answer to questions and answers that will then also be posted on the DCYF webpage for sure, and potentially DOH, depending on what comes of this. So with that, Amanda, can I give it to you and take it away?
Yeah, absolutely. Thank you so much, Jennifer, and the whole team at DCYF for setting this up, communicating out with all of you who are listening to provide this opportunity, for this very timely opportunity for us to review the guidance changes that are being put in place to go into effect on March 12th. As Jennifer had said, my name is Amanda Geffro. I work at the Washington State Department of Health on the COVID-19 response and serve as the COVID-19 guidance and external affairs lead. I would also like to, Kim, if you are able to unmute, just to introduce yourself. Kim is a newer member to our DOH team, and we are very excited to have her on to support some of the work for K-12 schools and childcare. Kim, are you able to say hello?
I am. Hi, how are you? So grateful to be able to join you today, and looking forward to being able to collaborate and continue to work together for our kids. So thank you so much for having me here today.
Thanks, Kim. Okay, so Jennifer set up some of the parameters of today so well, and I just wanted to add that I do anticipate we will have some time for question and answer, though. I know that there are many of you on this call today, and we may not have time to get through everything, and we may also need to take some questions back to our subject matter expert teams. It is by no means just myself or Kim who have written this guidance. We have worked with quite a large number of folks, both internally at the Department of Health, as well as some of key partners in this sector and with schools as well, to help craft this guidance. So there may be times where we have to let you know that we will get back to you with a written answer shortly after this presentation. All right, and with that, I also want to note I will not be monitoring the chat or the Q&A while I'm presenting, but once we get to the Q&A portion, I will try to do a better job of doing so. And we will jump right in. So we wanted to start off with just a look at the timeline. I think this really helps to ground and level set all of the things that have really kind of progressed over the last few weeks. Many of you had seen or heard the governor initially made announcements for plans to rescind the mask mandate in mid-February, with another follow-up announcement on February 28th to move that deadline up to 11:59 p.m. on Friday, March 11th, meaning that on Saturday, March 12th, the mask mandate, the statewide mask mandate, would rescind. And the governor indicated in consultation with DOH and with a number of our data and modeling experts that we would also remove the statewide mask mandate that had been in place for schools and childcare and a number of other settings. So we had worked with, over the last few weeks, as I mentioned, a number of subject matter experts across DOH, as well as folks in the sectors that this guidance will impact. As of this morning, we have released the updated DOH guidance for K-12 schools and childcare. And that guidance, while it is posted now, does not go into effect until after the statewide mask mandate rescinds this Friday evening. So we wanted to make sure that the guidance was out there to allow you time to see it and to prepare and to ask questions and reach out. But just a note, please continue to follow the guidance that had previously been posted and is still available on DOH's website through Friday the 11th, but that this guidance will go into effect on Saturday, March 12th. To look at the summary of changes that you can expect in this, we really wanted to prioritize the health and safety of children and staff, while also maintaining the continuity of teaching and learning in these settings. The goals of the Department of Health as we move into this next phase of the pandemic response is really to continue to empower individuals to know what tools are available to protect themselves and their families, and that they can do this through vaccination, through continuing to use masks if they choose or at times that they choose, and accessing testing. It's going to be important to continue to protect the rights of students, children, and staff to access and use these personal protective measures as we move into this next phase. The Department of Health also wants to practice normalizing the use of public health measures to prevent and minimize illness everywhere in the public and also in schools and childcare. The way that we have designed and framed this guidance as a transition from the large set of requirements that has existed throughout the pandemic into this more transitional period where there are still some requirements in place, but a number of the measures have now moved to advisory and really just create a framework of disease prevention and mitigation to help support schools and providers focus again on the learning and developmental needs and the social interaction needs of those that they serve. So to speak a little bit about why the Department of Health and some of the other state agencies have been working together to feel that this is the time and the place that we can do this now. Looking at disease trends across our state, we thankfully have really seen a continued decline. And this is something that we've seen echoed looking at nationwide data and even looking at data from other areas around the world, watching what has happened after the Omicron wave and taking into account our vaccination rates, which we will show a slide on next, as well as the continued access to a number of the mitigation tools. We can mention as well, I don't have it on this slide, but it is available at the link that is on the slide on the DOH dashboard, that our hospital admissions, which is also a key indicator that we keep an eye on, also continues to decline. All of these trends are moving in a direction that really give us the confidence to feel that this is a time when we can start to shift and adjust the approaches that we have taken across the state to move to a place where things are a little bit more flexible and a little bit more advisory. As I mentioned, we continue to see really impressive numbers for vaccination across our state. We've hit some incredible milestones throughout the pandemic. And as of yesterday, 81% of the population 5 and up has received at least one dose of the vaccine, and 73.4% have received their 2 doses of their primary series. These are numbers that we are incredibly proud of. To all of those across the state of Washington who have chosen to come forward and get vaccinated to protect themselves and their family members. And we continue to champion all of you who have helped connect those to those resources and make this possible. We know that the younger groups have not had vaccination eligibility for as long of a period of time. And the Department of Health will continue to support efforts to make vaccines widely available to those of all ages and including those in our younger age groups. So to take a look at a glance of the guidance that has posted that again will go into effect starting March 12th. The requirements you will see on the left feels like a lot still, but I would just like to note that all of the dot points on this screen were at one point a requirement. So we are moving a good chunk of those over to advisory or optional. And also, I would like to call attention to a couple of the requirements that are not necessarily specific just to COVID-19. The 2 dot points at the bottom of the left-hand side about reporting cases and outbreaks and responding to outbreaks, a lot of that information is covered in a statewide WAC, in a rule that we will make sure that the specific WAC is provided to you all, and it is listed in the guidance. But continuing to report cases and outbreaks and working with local public health continues to be a requirement, COVID or not. And I also want to call attention to the first dot point under the requirements, the employee vaccination. That is under Governor's proclamation, and would like to note that will stay in place for this time. Taking a look specifically at mask requirements, because the lifting of the statewide mask mandate is really the, I think, key change point for this transition. Looking ahead for the next phase, masks will continue to be required in nurse or health rooms, in isolation rooms, and may be required days 6 through 10 of isolation unless the person has tested negative. Areas and times when masks may still be required might come into play either in coordination with local public health, or of course, if a provider or if a business or an organization makes an internal agency policy choice to continue mask use for any reason. There also might be times during higher risk activities where masks may be recommended or required, particularly if we start to see outbreaks or higher levels of disease rise again in the community. Masks may also be included as part of an individual or staff accommodation. But again, just a reminder, this is really handled on a case-by-case basis, and therefore the Department of Health does not put forward recommendations around accommodations. We just want to note as well, just some general messaging, to always be kind and respectful. Everyone will be through this transition at a different place of comfortability when it comes to masks. And there are some people who will choose to or need to continue to wear masks. So it will be important for everyone to support one another in those individual choices as we move forward. I want to note that many of you have seen resources that have previously been available specifically for schools. And I want to note that in putting together this next transition of guidance that will go into effect on March 12th, we are really working to develop and update a number of these resources in a way that they will be usable and accessible for childcare providers and other youth serving settings as well. The previously referred to as decision trees will be shifting a little bit, but will be, again, adjusted in a way that we hope that they will be usable to you all to be able to use within your organizations, and also to be able to share with parents as a visual quick reference tool to be able to kind of explain if there's symptoms, returning after exclusion from symptoms, and what to expect if they receive an exposure notification. So look for this document to be updated throughout the week and will be available by Friday. So to go into a little bit of detail around the return from isolation, noting that isolation will remain a requirement. So this is around individuals who have symptoms or have tested positive for COVID-19 to isolate at home for at least 5 days. A person can return after 5 days if their symptoms have improved or if they have remained without symptoms. And also with the key qualifier of those symptoms, that they have been without fever for the past 24 hours without the use of fever-reducing medication. If the individual is returning to work or school or care after day 5, the individual is going to be strongly recommended from the Department of Health to wear a well-fitted mask or an appropriate face shield with a drape during those days 6 through 10 after their isolation period. There is an option that we wanted to be able to provide for those who may not be able to wear a mask, that if they test negative after day 5 with an antigen or at-home test, they could return without wearing a mask. We just wanted to note as well that testing beyond day 10 is not necessary. The individual can return after day 10. And lastly, at the bottom, as kind of a third option of sorts, if the individual is not able to wear a well-fitted mask or face shield with a drape, which we know impacts many of our youngest age groups that you all serve, and they do not test negative, that they should continue to isolate through day 10. Exposure notices will be a mechanism that will really replace the one-on-one individualized contact tracing that has been in place, particularly in schools, but we know that many of you have also done significant work in the realm of contact tracing over the last months and years. The exposure notices are really designed to be a little bit more broad-based and hopefully will be less burdensome. The active notice of potential exposure to employees does remain a requirement through L&I requirements. Links to their rules are included in the written guidance document. And we would also like to call out that individual notification for children or staff who are immunocompromised, medically fragile, or otherwise at risk for severe disease is strongly recommended. Some of the systems for informing a broader school or care community of cases and outbreaks could look really different just depending on your audience, the needs and capabilities of your organization or agency. So this could be a newsletter, a dashboard, or group notices or letters or emails that are sent out to families. We at the Department of Health are working on a couple of template letters that will be accessible to you all on our website. There is a note about access to testing for individuals who may be exposed. We recognize that schools have had robust programs set up through the Learn to Return program. And we also want to make sure that we're communicating as many resources and access to testing as possible for childcare providers as well. Going to the DOH testing page can be one of a couple of options to start gathering information that you can share throughout your organization and also with parents and families. At-home testing will likely play a pretty significant role in the testing resources used moving forward. And on the DOH testing page, there is a link to the Say Yes COVID test, where families can order free COVID tests to be delivered to their home. There are also links on this page about federal resources that are available. And of course, we would always encourage you to reach out to your local health jurisdiction if you have questions about accessing testing resources, as they may have connections as well. I recognize that was a very quick run through of the changes, the updates, but I really wanted to be able to create some time for some question and answer. I want to express my huge gratitude to the team at DCYF and a number of partners in the community who have supported the Department of Health, not only in the development of the guidance, but also to all of you who have done such extraordinary work to implement these guidelines and continue to persevere through really challenging situations. I can be reached through the COVID External Affairs email address on that page. You are welcome to send questions there if you have them. As Jennifer noted, we will be collecting questions that come through this presentation forum, and we'll be providing a written follow-up later this week, along with links to all of the current and upcoming resources that will all go into effect again on March 12th.
Thank you so much, Amanda. for your time and your expertise today. I have been keeping track of questions, so we will stop the recording at this point. Emily, if you can make that happen. And Amanda and Kim, if you have the opportunity, I think our plan was still to address some of the questions that have come through.
That sounds great. I'm going to stop sharing my screen just so that I'm able to more readily access some of the questions. Sometimes it's helpful for me to be able to view them as I answer them. So
yeah.
And
so I've been keeping track. Yeah.